so interesting how, yeah, but behind it feels even now, just because so many other industries have moved beyond that, right? Like if I want a reservation at a restaurant, I can go to Yelp or I can go to OpenTable. I don't have to call the restaurant anymore. If I want food delivered to me, there's a number, including Uber Eats, right, that I can call and get food delivered to me. And this whole concept, or of course, Expedia and travel companies that do get to reserve slots, and they added so much efficiency and then choice, right, to the system and transparency to the system for the end
Right.
consumer, and yet the health care system
Wait, so
has not moved
so
there. Yeah.
at the very beginning of this, I was in contact with Arun Sundararajan, who wrote the book called The Sharing Economy. So he's an
Okay.
economist out of NYU, and it was about like the Lyft and Uber and
Hmm.
Airbnb and how they came about. And the concept was that you have two versions of economics. You have these hierarchical corporate models, and you have peer-to-peer transactions.
Hmm.
So you think that Airbnb, Lyft are disruptive because they're in fact a peer-to-peer marketplace. Like Amazon is a marketplace, peer-to-peer, right? People are buying and selling on it, peer-to-peer.
Hmm.
But in fact, a corporate model is the disruptor because 90+% of business transactions in the world are really peer-to-peer. They're your local business person, your cobbler making a shoe or a baker making bread, right? I mean, most of these are peer-to-peer transactions. Corporate the corporate model is actually the disruptor. So when you think about medicine is a pure peer-to-peer transaction, always.
Hmm.
Doctor patient, in a hospital, nurse, it's like it is a peer-to-peer. But we've tried to make it a corporate model. And those top-down approaches, again, work in public health, like everyone should wear a seatbelt, nobody should smoke in public places. That's a nice top-down initiative. Vaccination, perfect example. But
Hmm.
that's not medicine. Medicine is not top-down. Medicine is like, you have this particular disease. There are 5 choices for me to treat it. We're going to choose the one that is probably, what we think is going to be best for you based on what we know. So it's a peer-to-peer transaction. So from an economic model,
Right.
that's how it's